Hello, my name is Dr. Paul Scheiwiller. I'm an anesthesiologist at the Institute of Orthopedic Surgery. I'd like to talk to you today about your hip joint injection. Before we get started, I want to introduce you to the members of the team. You've probably already met the SBA. The SBA is a special blocking assistant who has received additional training on how to assist with block procedures. The SBA will be positioning and assisting in the procedure. She is also in charge of monitoring you before, during, and after the block. Very shortly, you'll be meeting the anesthesiologist. He will be the person that will actually do the procedure. You're here to see an anesthesiologist because anesthesiologists, many, have considerable experience using an ultrasound machine for needle guidance. This allows an anesthesiologist to place needles or other objects into very specific locations, for example, your hip joint. We'll be utilizing steroid medications today. Steroid medications are anti-inflammatory medicines, and that's all that these medicines do is shrink inflammation irritation. Unfortunately, they won't repair your hip or remodel your bone. They will not restore cartilage that may have been lost, but again, they do a terrific job at helping to control inflammation irritation in the joint itself. If you have significant inflammation irritation, you may get very significant temporary relief. This will last until the inflammation irritation returns. It's hard to say how long the relief may occur. Several weeks, several months. If you were to get 6 or 7 months, that would be outstanding. However, if your symptoms are from somewhere else other than your hip, for example, your back, which could be a pinched nerve, or outside the hip joint itself, your relief may not be so good. You may receive very little pain relief, very short-term pain relief, or you may receive no pain relief at all. We'll find out because we'll place the steroid medication today. It takes at least 3 days before you will notice any improvement. It can take as long as a week. Hopefully you'll receive significant relief. We define significant relief as a rough guideline of 70%. We don't do another injection until the inflammation irritation would return. Your symptoms would return. That's how you would know the inflammation irritation is returning. Call us when your symptoms are starting to return. Don't wait until they are very severe. Or call your referring doctor. We will let you know what the plan is and review it with you. Again, these procedures are designed for your comfort and safety. You will be positioned on your back, laying flat. The area will be prepped and draped. An ultrasound probe will be placed on your groin area, which is where we enter the hip joint. The ultrasound machine allows us to see into the hip joint. We then numb up a patch of skin with a tiny numbing needle. We place a specially designed block needle through the numb skin, and it is directed into the hip joint. We watch the procedure on the screen as we are doing it. Once the needle is in the hip, we inject the medications. Again, we take a small movie of this for documentation purposes. We remove the needle, and we're done. Of course, anytime we place a needle in anybody for any reason at all, there is a small amount of risk. These include bruising and infection. These are not common. There can be damage to your hip or surrounding structures, which include veins, arteries, or nerves. These are very rare. Medication, which is very strong, can increase your blood sugar if you're diabetic, and also can retain fluid around your feet and ankles, generally lasting no more than 2 weeks. Again, we will monitor you closely during and after the procedure. A few housekeeping tips. Your guest or guests will be asked to exit during the procedure. We will bring in our equipment. You will be hooked up to our monitors, which include EKG, finger clip, and blood pressure cuff. We understand if you're nervous, but don't worry, we're going to take great care of you. There'll certainly be time for questions. If you have any questions or anything that I haven't covered, please don't hesitate to ask. Thank you.